All right, welcome everyone. Thank you for joining us this morning, this afternoon, this evening, wherever you might be. It's my pleasure to introduce our next speaker from Everbridge Corporation. So Imad Mouline is the Chief Technology Officer at Everbridge, and in this role, Imad is responsible for Everbridge's marketing strategy and his product roadmap, innovation, and research and development. So we're very excited for this presentation. In terms of questions, please type them into the chat box and we will answer them as we go. And we will also leave some time at the end to answer questions. So without further ado, it's our pleasure to introduce Imad Mouline. Take it away. Thank you.
Thank you very much. And thank you everybody for tuning in wherever you happen to be. Hoping for an interactive session. I'm going to start by giving you a brief overview of what we do at Everbridge, as well as our evolution. And this way, if you have any questions from a business perspective, an entrepreneurship perspective, given that we're viewed fairly widely as a pretty nice success story, please ask away. We'll then tell you about what we actually do and what we've been doing to help with the COVID-19 situation, both early on and as part of our road to recovery. And then again, if you have questions about the subject matter, the technology, the business, please feel free to ask along the way. As Attila said, I'm Imad Mouline, responsible for the overall product and technology direction for the company. Been with the company for about 10 years. At Everbridge, we're a software as a service provider, and we have a mission. Our mission is to keep people safe, and then to keep businesses and organizations in general running, and hopefully running better. We have about 5,300 customers around the world, including customers that may be countries. We do country-wide alerting for places like New Zealand and Singapore and Norway. We do statewide alerting. For example, for those of you who are in Florida, if you're getting an alert to evacuate or telling you where COVID testing is available, typically that would be through the Everbridge platform. And really that's where we started, doing mass notification. You could see that from an overall business perspective, things have going pretty well, going from a $23 million ARR in 2012 to a little over 200 million in 2019. Almost all of it recurring. We had our IPO in September of 2016, about $400 million in market cap, and are now hovering a little over 4 billion, between 4 and 5 billion. So again, happy to take questions about entrepreneurship, etc. One of the reasons that this growth was fueled was certainly by the fact that we expanded our purview. We started as a mass notification provider, allowing, right after 9/11, providing a solution so that first responders could be communicated with, so that residents in a particular area, employees, authorities, moved on to critical communications by expanding into ultimately any type of communication that was viewed as urgent, including IT communications. If a system went down, making sure that the right people could be rallied and brought on board. And then critical event management, which is a much broader area, but still delivers on the mission of keeping people safe and keeping businesses running. So what is critical event management? Well, it starts by acknowledging what's out there today, that there are more and more bad things happening, whether it's ultimately man-made issues or natural disasters, or obviously a pandemic that is not going away. Things that disrupt our lives and our livelihoods, persistent, global, pervasive, and we're there as Everbridge to help deal with it. So going back to what a critical event is, let's start by defining it. The definition is actually quite simple, and so is the value proposition. Every organization, be it public or private, has things that they care about and things that they worry about, good things and bad things. When something that an organization worries about impacts anything that that organization cares about, that becomes a critical event, right? So for most organizations, these good things typically start with people. That could be employees, customers, patients, students, visitors, but it also can include assets, buildings, facilities. These good things also include IT operations, including business critical IT applications. It could also include suppliers, supply routes, the entire supply chain, physical or digital, and of course, brand and reputation. They can be paramount for any organization. So when a critical event occurs, a CEM or critical event management system can kick off the right protocol to ensure that what needs to be done gets done to minimize, mitigate, eliminate the impact. That's what a critical event is. And that's how we really want to be able to manage a critical event. You want a streamlined approach that can be really broken down easily. First and foremost, you need to know what's happening. You need to trust the information. It needs to be timely, accurate, operationally constructed. You need to be able to then answer the question, which is the most important one, right? Do we care that that bad thing has happened? As in, does it impact me? Does it impact my organization? We need to do that really quickly, automatically identifying everything and everyone that may be impacted. And then we need to initiate the response, right? Who needs to do what, when? Is it done? And then have we done the right thing? We need to record every interaction, every task, every response, every action, make adjustments as needed. We can do it all so as to uncover every inefficiency, every bottleneck, so that the next time around, we can do better. We can have a better outcome. And a better outcome can mean we are going back to work more quickly, we're recovering from a disruption much faster, or there could simply be fewer casualties. Make sure that every subsequent critical event has a better outcome than the one that preceded it. So I'm not going to go into every step what we do, but I'll give you the illustration with how we adapted the system to help with COVID. But one key aspect of the CEM platform is that it's really always on. There might be some nice screens and visualizations that you'll see, but it doesn't matter if nobody's watching the screen, if nobody's actually using the software, because the system is simply on. If the teams are off duty, CEM is on. If the teams are off the grid, CEM will be on. If the teams are off the clock, Everbridge CEM will be on. And if the teams are simply having either a day off or an off day, Everbridge CEM will always be on. So let's take a look now, ultimately, at how this applies to the current pandemic, right? We need to first acknowledge that conditions surrounding this pandemic are constantly changing around us, around the world. You know, we see some hopeful signs at times that the virus's spread is decelerating. In some cases, we see death tolls going up. We see a resurgence here and there. We see essential workers who are putting their lives at risk, right? And then we see all kinds of information coming in. Stay-at-home orders, confinements, lockdowns, quarantines, states of emergency, restrictions that are being loosened in some places and being retightened in others, right? Vaccine hopes, new outbreaks, new questions, new concerns, ever-evolving conditions. And to add to this complex landscape, right, we're starting to see phased reopening plans being published at the state, at the regional level, in Massachusetts and Rhode Island and New York. We see plans that have some similarities and many differences. Some that have phase gates that are well-defined and others that are maybe labeled TBD. So things are changing. So how does an organization that has interests in one location, let alone multiple countries, deal with this type of complexity that's always changing? How do we recover? How do we get back to work when everything is changing, not just from place to place, but over time? So this is the approach that we're bringing to the table, right? Starting with knowing the landscape, knowing really what's happening, protecting people, recovering operations. So the key first is, of course, to really effectively protect the health of the public. while unquestionably protecting the privacy of the individual. So let's start with knowing the landscape. We've all seen charts like this, charts showing the number of confirmed cases, for example, the number of deaths, the number of recoveries, all on a country by country level or state by state or even county by county level. This is a good start, and rates and trends can be even more useful. But how did this relate to keeping people safe truly, especially on a local level, especially if your scope is global? This is where understanding the impact of the pandemic comes in. This is where visibility into the actions of local authorities and the reactions of their populations comes in. So what is the status of quarantines, for example, in states and countries around the world? What about curfews? What about states of emergency? What do they entail? What are the specifics? What about the impact on transportation? The impact on transportation of goods versus people, local versus long distance, domestic versus international? Are there bans from specific countries to specific countries? Are a country's nationals allowed back in? What about permanent residents? Are there export restrictions? Right? Knowing all of that helps. For example, in academia, right? What happens to F1 students? Are they allowed back in? What about faculty that might be international? What about production stoppages? Are major manufacturers operating? Are they getting back to work? Have they converted their manufacturing capacity to make masks and build ventilators? When do they plan on converting back? So are they your suppliers, for example? Are your suppliers being impacted? So what does that mean for your supply chain? Right? So, and how are local populations dealing with the impact of the pandemic? Are the impact of restrictions imposed upon them by the government? Are there protests? Is there a civil unrest in any particular area? Is it near any of your facilities? Are any of your people going to be caught up? And yes, in case you were wondering, protests have intensified worldwide, but that's not all, right? As you know, Mother Nature is not sitting on the sidelines waiting for us to deal with COVID-19. Your best laid plans may yet be thwarted completely by another, in this case, natural disaster, right? Hurricane season is upon us. You see what's happening right now in Louisiana, right? Cyclone season is upon us. Wildfire season, obviously. We're seeing what's happening in California with the air quality. Thankfully, heat wave season hopefully is just past us. So will any of these critical events have an impact on a state or country's plan to reopen the economy? What about on your plans and your organization's plans? Right? So being able to trust that information that is coming in is key. Knowing that it's timely, that it's vetted, that it's accurate, that it's comprehensive. Knowing that some of the information on rules and guidelines is coming straight from the source, straight from the authorities, no filter, no bias, no noise. Other sources of information are deduplicated, deconflicted, auto-categorized, normalized. All of this becomes one source of information, one source to rule them all. So that's part of what we provide. Automating tens of thousands of sources, having analysts who are specialized, having our own customers who are in public safety. Those are all, for example, the ones you see on your screen, they all run the Everbridge platform. So they are the official source of that information that can go flow back into the system. So knowing all of this, knowing the landscape, we can now turn to protecting people. Again, there's more to protecting people than what you hear out there, which is, hey, let's do some contact tracing. Helping people minimize or even avoid exposure is important. Giving people the tools to stay safe, to report symptoms and to report test results. And yes, to even identify potential exposure. That is key. So I'm going to talk in a bit more detail about contact tracing, but I'm going to skip ahead for now. So let's just wait. We'll dive into each one of those areas shortly. So that's where protecting your people comes in. You also want to be able to recover your operations proactively, right? We've gotten to know the landscape, whether it's rules, regulations, guidelines, or their impact on local populations. We figured out how to protect our people, but now it's time to recover our operations. So how do we handle all of this? How do we get handle on the complexity when different things are happening differently in different parts of the world? So let's take a look, right? The key here is having automation help, turning the local or national laws, rules, guidelines, protocols, best practices, exceptions, overrides, and mandates into something that's more structured. So standard operating procedures, well-defined tasks, owners, due dates, metrics, escalation procedures, audit logs, and more, right? It's a simple, straightforward process. It's not just about digitizing the standard operating procedures. It's also about managing their execution, their completion, down to the individual task level, right? It's about knowing that no task will fall through the cracks and that every standard operating procedure will be flexible enough to change as the rules and guidelines invariably change. So things that may be done one way in one place will be done differently someplace else. Ultimately, if you're the person executing the tasks, what you know is what you have to do. You don't have to worry about everything else, right? Recovering operations also means managing your supply chain. Remember what we said earlier about knowing the landscape, states of emergency, transportation disruptions, stoppages. So knowing the landscape means that you understand how your suppliers and supply routes are faring. It means not only tracking disruptions, but staying ahead of them, staying ahead of the resumptions as well. So minimizing downtime, recovering our operations more quickly. You need to know origin, destination pairs, route paths, the status of ports, the status of transportation. You can turn it into a competitive advantage by staying ahead of the resumption as well. That's how the world can get back to work. So let's do a deeper dive now into just the contact tracing piece, because in many cases it can be the most controversial, but also incredibly effective as part of that overall solution, right? Our view of it has always been that it needs to be a comprehensive approach that includes more than simply identifying exposures and then notifying the people who are exposed. It also needs to include tools that can minimize or help minimize and avoid exposure. Tools that can help people identify their symptoms and report test results. Tools to manage follow-ups and follow-throughs on everything. So let's start with what is, traditionally narrowly viewed as contact tracing or exposure identification and notification. We'll get back to some of the other components as well, but traditionally there are two ways of doing contact tracing approaches, right? The manual approach where you hire a bunch of people and train them to be contact tracers. These employees can then, call contacts of newly diagnosed patients, record all of their information, typically in a CRM system, provide them with the information about testing and other procedures, and then follow up with them as required. It can be expensive, time-consuming, and not really for every vertical or industry. Typically, governments can afford to do that and have the people to do this thing. So the second approach is typically a mobile-based contact tracing approach. A lot is being said about the Apple, Google proximity-based contact tracing framework, right, called exposure notification. It's a thoughtful, incredibly powerful framework that allows smartphones that are really near each other to constantly record their proximity to other smartphones using BLE or Bluetooth Low Energy, then have their owners be notified if anyone they came in contact with all of a sudden reports testing positive. The focus is on privacy, obviously, with all of the matching being done on the device itself. The issue, though, is that public health authorities can glean very limited information from all of this, specifically because of the privacy protection. So the powerful approach here is that, of course, the system is always on behind the scenes. But again, it's limited in what it can do at a global level because it's really more focused on the individual in this particular case. So public health authorities only get so much. So proximity-based tracing really can be done with other frameworks as well. We have certainly our own. These frameworks can also protect the user's privacy, but have a little bit more leeway in reporting additional information, right, at least at the aggregate level, right? For example, are we seeing hotspots in a particular area around the world, right? So privacy-minded frameworks will only ensure that necessary information is transmitted and stored centrally. That type of information is just sufficient enough to allow the public health authority, for example, to understand the progression of the pandemic identified potential hotspots. So other approaches can also come in to complement these. So location-based tracing. It can leverage an app, but it doesn't really rely on it. Location-based tracing basically places an individual in a particular location at a particular time. This works well for corporations and places of work. Right? The approach leverages location data that an organization already collects, usually for other purposes. So for example, physical access control data such as badge swipes into a building or Wi-Fi access points. You can even look at hoteling calendars or even meeting calendars to help really trace an employee's step. But let's face it, no one tracing approach is going to be 100% effective on its own. Right? This is where we also can complement it with what we call area monitoring, which can help prevent exposure in the first place. These are fully automated systems that can monitor and enforce, for example, area density and capacity limits, help maintain physical distancing, and even check for PPE compliance on a shop floor, for example. Right? These are fully automated area monitoring systems that can count people in an area, for example, calculate the distance between them. You're not identifying anybody, right? You're simply basically raising an alert if there is an issue that can turn into a bigger issue, right? It can also alert when it basically finds that there's a human body with an abnormally high fever in a particular area. It can connect to building management systems to ensure that guidelines on temperature, ventilation, humidity are all being followed, right? So a lot of different areas that can be layered on or solutions to help get to an effective, really, result. On the public safety side, authorities can also make use of public warning systems, usually those systems that are used to send out alerts about an evacuation or whatnot. Right, so these are systems that in some cases integrate with mobile network operators, and they can provide insight into crowds and crowd movements. Right, they don't even need to integrate with every single mobile network operator in a region to be effective. But systems can be deployed so that the only insights that are gleaned are those at the aggregate level. You're absolutely not tracking an individual. You don't know who's where, but you know at the group level, for example, what's going on. You know what things looked like potentially, a few days ago. When a country, for example, started loosening its restrictions, you can actually identify if there are mobile users or operators who are coming in from another country and send them specific instructions based on their country of origin around, for example, quarantines. You can do all of this without disclosing any personal or private information, because that never leaves the operator. All you're seeing is aggregate numbers, aggregate locations. Again, this is part of helping keep people safe, stop the spread of the virus. So that's how proximity-based tracing, location-based tracing, and area monitoring can work together to provide really a more comprehensive approach to identifying potential exposures. So, but what else can be done to help limit exposures in the first place? So what about proactively keeping people safe? So providing people, employees, residents alike with the ability to basically check their symptoms and giving them advice and instructions based on their input, right? Guiding them to testing or healthcare facilities based on those symptoms. Guiding them both outdoors and indoors, right? Directing them not just to the right building entrance, but to their destination while avoiding exposing others, right? Ensuring, for example, that hospitals, healthcare facilities can provide directed COVID patients, directed instructions to COVID patients while reopening their doors and providing services to non-COVID patients. We can keep them separate, right? This works as well in academia, ensuring that if you're putting together ultimately instructions for people where to get to one particular point from another, you can do that using indoor wayfinding capabilities as well, right? Avoid ultimately too many people in one particular area. Create one-ways. So this is where, again, we can help healthcare systems keep their patients safe while getting back to the mission and business of providing services for all. Keeping people safe also means warning them of hot zones or areas of high exposure risk. So not just at a building level, but potentially at a region level, whether it's a wing of a building or an entire region or country. These incident zones are geofences that automatically trigger a warning or an alert as soon as you cross into that fence. Right? But here's the thing, despite all of these efforts to avoid exposure, unfortunately, people do test positive. So end-to-end contact tracing needs to include tools that can help when that happens. Tools that can help individuals proactively report their test status, but also automated wellness checks that can be triggered or scheduled by the organization. It could be, again, at the country level, at the county level, at a university level. The results can be used, for example, to grant access to a building or campus once you've answered the questions on the wellness check. But they can also be used to follow up with any group that gave a specific set of responses with the appropriate types of guidelines. So we've provided tools to help avoid exposure, tools to report exposure, tools to identify potential exposure. What's needed next is the ability to provide and manage the follow-up, the follow-through, right? Everything from linking to testing locations to automating follow-on wellness checks, right? To providing integrated, at least in the US, HIPAA-compliant secure chat and full case management capabilities, right? So this is why we say that end-to-end contact tracing doesn't end with simply the exposure notification. It's got to be a full set, really, of capabilities that help in these cases. So that's how, in a way, we take our critical event management capabilities and adapt it to help with the pandemic. We've provided tools, right, to help avoid exposure, tools to report exposure, tools to identify exposure. We've done all of that. So end-to-end contact tracing is one of 3 pillars of a comprehensive return to work, road to recovery solution that includes everything else that we mentioned before. Knowing the landscape, protecting your people, recovering your operations. Again, I look forward to your questions. I look forward to hearing from you. We actually have here at Everbridge a webinar on a global basis that's happening October 14th and 15th with some amazing keynote speakers like Dr. Anthony Fauci, Dr. Sanjay Gupta, Sir Richard Branson, to help discuss where we are, where we're going, and how we can help the world recover. It's open to all. You're welcome to join us. And now I look forward to your questions.
Yeah, Imad, we have a few questions that have come in. The first one, could you talk a little bit about the industries that are at the leading edge of adopting this type of contact tracing?
The industries?
Yes.
Yes. So what we're seeing, the contact tracing is sometimes viewed as very narrow, right? Just that proximity-based contact tracing capability, right? We view it as a much broader, overall approach that may include the manual contact tracing, that may include ultimately the proximity-based, the location-based, the area monitoring capabilities. So what we're seeing certainly is where the public safety hasn't necessarily stepped in to provide a comprehensive mechanism for doing any type of automated contact tracing, that specific organizations have done so. So we've seen a lot of universities, for example, use the capabilities that I just showed you as a way to help students go back to campus. And that typically includes, first and foremost, the wellness checks, the symptom checking, right? In some cases tied to what I mentioned before, which is you're only allowed on campus after you've answered the questions. You have to actually show ultimately a green check mark on your app. And also proximity-based contact tracing, where again, two people coming in contact with each other, that information really only stays on the student's device, but that student is then notified if anybody that they've come in contact with, without ever identifying that person, has tested positive. Again, the idea is to contain that spread, to then kick off a protocol that says, well, in this part of the world or the country, right, if we believe you've come in contact with somebody who's tested positive or who's had symptoms, here is the protocol. We want you to self-isolate or quarantine or go get tested, right? The protocols themselves can be pretty flexible. So that's in the university and college setting. We've seen corporations take advantage of these capabilities quite a bit, right? They tend to start with location-based tracing because they have information typically in their systems that now simply flows through Everbridge around who has attended what meeting, assuming that they are already starting to attend face-to-face meetings, or who's badged into a building, or ultimately who's connected via corporate Wi-Fi in this building or on this floor or this part of the organization. That information then is all brought together and analyzed by the system, so that again, if somebody does go ahead and let the system know that they've got symptoms or that they've tested positive, then the system can figure out who may have come close to them, who may have they come in contact with, so that again, the appropriate protocol for that company can be triggered. Whether it's asking those employees who may be exposed to work from home or to go get tested or whatnot.
Good. Another.
So obviously, part of what I've mentioned before at the public safety level, it's not strictly contact tracing, but the idea that at a country level, you can get a good sense for the density of people in areas. You can even turn back the clock and see if ultimately you had a large number of people in what is now a hotspot and have the ability to message them anonymously, understand potentially how population movement might be impacting the spread of the virus, enabling public health authorities to put in place protocols to help slow it down. These are solutions that all need to work in concert with each other. We're all in this together. So whether it's organizations doing their part, individuals obviously, and then public health authorities at multiple levels, including international.
Good. Another question related to that, Imad, is how widely have we seen government regulations vary around the world related to contact tracing? How do we work with different government regulations related to this?
Yeah, that is really part of the challenge, especially for multinational corporations, is that rules, regulations, best practices, protocols are different, right? So typically what we have to go through every single time is an in-depth review on data protection and privacy. And we're always eager to do that because we spent a lot of time going down that path and ensuring with a variety of, not just from a technology perspective, but from a philosophy, perspective, that we're doing the right thing. Collecting the minimal set of information, always ensuring that the end users know what information is being collected when and what for, using plain language to let them know that information, never overwhelming them with legalese, and always ensuring that if information really isn't needed, that it's not collected, that it's aggregated and anonymized. Again, just like what we do on a large scale. So typically that's really the first thing that we deal with. And again, it's not just at a country level or at a state level. Those questions, because they're really good ones, typically get answered every single time by every organization of every size. Because the only way to truly help protect the health of the public is when you can ensure that you're safeguarding the privacy of the individual. So that's typically the first thing. And rules and regulations are different for at the organization level or at the public health authority level. Then it's about understanding, as I mentioned before, well, what's going on? I mean, rules and regulations are going to be different because different countries, different states are in a different situation. What mandates are there? What's allowed and what's not? What stage are you in your overall recovery plan? So different things have to be implemented differently. And then obviously at the country level as well. So for just about everything that I've mentioned, you have to have a different approach. So part of what we had to do, especially in a software service environment, is simply build configurability. So it's not different code for every organization or every country. It's a single platform. But there are knobs and switches that help it behave differently in order to ultimately deal with the way that a particular organization wants to conduct not only its contact tracing, but its full return to work capability.
Imad, I got a question about the background that's behind you. What type of data are you showing here? What type of data does Everbridge provide its customers? Can you talk more about this interesting background behind you?
Yeah, so this is really just one of the visualizations of our critical event management. The visualization, again, is very nice, but it doesn't need to be on because the system is always working. The system is always looking for the things that may impact an organization, and it's always keeping an eye on all of the things that an organization cares about. So typically what you have here is all of what we call risk events. Again, those are things that we provide. This is a flow of information that is vetted by our analysts, but that really starts with scraping data from 22,000 different sources, adding to it research that our analysts do, having them translate the information. We, I think, speak about 15 or 16 different languages, and the information coming in from the emergency management agencies and public health authorities and law enforcement agencies that ultimately leverage our platform to disseminate information. Because they're disseminating it, we have the ability to bring it back in, especially when it comes from the authorities themselves. So that's really the first step, bringing all of that information in a timely manner, in an organized, structured manner. So, and then it's really about taking information about an organization's own assets and people. And it could be where people live, where people work, where they're traveling to. We grab information from itineraries so that we can stay ahead of an issue. If you have an employee who's traveling towards an area where something bad may happen, the system keeps track of all of that, behind the scenes. Your assets, where your offices, where your campuses. And what the idea here is behind this particular visualization is that it's only going to tell you when something bad is going to impact something that you care about, right? And it'll keep it on one of the screens. So each one of these screens is giving you really a different perspective on what's going on. Some focusing on one particular critical event, others giving you a summary. For example, one of them is saying that, look, the system is right now tracking 63,750 different assets between people and physical assets, et cetera. And about 40% are in an area where there is an active alert right now, right? It's also telling me that right here, right, 3,276 alerts have been processed in the last 24 hours, but we've only alerted on 161 of them because that's where we had people or assets that we care about. So this is something that can be used in an emergency operations center, in a security operations center, or honestly, each one of these screens works just fine on my iPhone or my iPad. I can bring it up if I'm on a plane to see do we have any situation going on right now? What's the overall impact? What are we doing about it? Where are we in that response process? Who's involved? And how well are we doing ultimately from a recovery standpoint?
Looks like we have time for one more question, Imad. What was asked here was, who are the decision makers Everbridge sells to? Who purchases Everbridge, and what are the titles of the people at these businesses that use our service?
It depends on the vertical and the industry, right? So typically, from a public health authority perspective or from an emergency management perspective, right, it's going to come from the director of emergency management at a city level, a county level, a state level. For example, in a corporate setting, because we deal with ultimately employee health and safety, it may come from the chief security officer. It could come from the head of HR, in some cases, both at the same time. Because we deal with IT systems as well, we keep track of whether IT systems are up or down, making sure that the appropriate people are dispatched, those with the right skill sets, those with ultimately the right availability. The CIO is typically involved as well, right? In the healthcare side of things, we have about 1,000 or so hospitals that use our system to keep staff and patients safe, to ultimately call out to nurses and other medical personnel if there is a surge, right, in critical events, if you need specialized medical professionals to come back in to figure out who's available and who's not. In that case, it could be the CMIO, Chief Medical Information Officer, who's making that determination. So anybody whose job it is to help keep people safe, to help keep the organization running and running well.
Great. Well, I think we're down to 2 minutes left here, Imad. There was one other question just about the upcoming symposium. Anything else you want to say about that?
Just that we'd love for you to join in and ask a question of some of these incredible keynote speakers. I think Dr. Gupta will be headlining the first day, Dr. Fauci the other. We'll have Richard Branson. We'll have some world leaders, as well as corporate leaders from around the world. We had a similar symposium a couple of months ago that attracted about 10,000 people. That was, incredibly insightful. And this is how we can all help each other. No one organization, no one person is going to ultimately solve the issue that we're dealing with here. It really is all about us all coming together and doing our part. At Everbridge, we're incredibly proud to be able to deal with the situation and help organizations deal with the situation. Which also reminds me that we're hiring. I don't know if I'm supposed to say that, but so please, if you'd like to do well by doing good, join us as well. We're always looking for individuals who want to really make a difference in the world. Technology company that's doing great and that's helping keep people safe, save lives and livelihoods.
Thank you.
Great. Well, thank you both, Imad, for this awesome presentation. It was very helpful to explore from a global perspective how technology company is able to provide real-time solutions. So thank you for sharing that with you. And thank you, Jeff, for moderating the questions and for spending the time this early morning with us. And with that, we will end our presentation and transition to the next one. Thank you very much to all the participants for your questions and for your rapt attention. Thank you. Have a great day.
Thank you.
Thank you.